TMS stands for transcranial magnetic stimulation. It's a strategy for treating mostly depression, as well as a couple of other conditions. And it uses magnets to activate parts of the brain that have been asleep. Well, it does sound like science fiction, and I've been doing TMS now for almost 5 years here in the New Bedford office. And even now, after having treated a few hundred patients, I still find it remarkable that you can place this item on a person's head, and some weeks later, their depression has most of the time lifted. So this magnetic coil pulses and delivers magnetic energy to the prefrontal cortex and other parts of the person's brain. So this was discovered, more than 50 years ago, when a British bioengineer actually placed a large magnet over a nerve and discovered that when the magnet was turned on, there actually was a pulse coursing through the nerve. So this led to the discovery that you could actually activate a nerve with magnetic energy. Sometime after that, actually in the 1980s, an American named Mark George began to experiment with stimulating nerves with hundreds or thousands of pulses, and discovered that you could actually activate parts of the human brain by using this magnetic energy. Mark George's research led Neuronetics, which is the parent company of Neurostar, to perform the first clinical trials, which led to FDA approval in 2008. So that's 13 years now that we've had TMS available, at least with the Neurostar system. And we have more than 4 million treatments have actually been given now with this. So on the one hand, it's actually a rather new part of our medical science, and at the same time, it's beginning to really gain approval and gain acceptance in more and more parts of the world. One of the most common questions that we get from people when they approach us about having TMS is, how is this similar or different from ECT? And I explained that it's actually very, very different. ECT involves the use of anesthesia, and it actually causes a seizure, which is why it's done under anesthesia and always done in a hospital setting. TMS is profoundly different. There's no seizure, there's no anesthesia. It's done in an outpatient setting almost all the time. There are hospitals that have TMS practices, but the vast majority of TMS offices are in outpatient settings. It's incredibly safe. People do not need to be worried at all about the fears that people typically have at VCT. There's no memory loss. There's no confusion. When people come for their treatments, they're able to drive to the office, have their treatment before work or during their lunch hour or after work, and then when their treatment is done, they get on with their day. You just get out of the chair, get back in your car, and it's not a although TMS does involve a commitment of time, it doesn't interfere with your ability to function in life. So the original studies that were done, the clinical trials that were done for the FDA, showed that about approximately 60% of people having TMS improved significantly, and of that number, about 35% actually had a complete remission of their depression. I will say that the more recent data, at least with the Neurostar systems, shows actually a higher success rate, and we've recently been seeing 90% success rate. So in other words, 90% of the people who come to see us have either somewhere between a 50% and 100% improvement. One of the other most commonly asked questions is, Doctor, when I have TMS, if it works for me, will I be able to stop taking all my medicines? Some people who have TMS, which works really well for them, do in fact stop their medicines, but a majority of people continue on medicines. TMS is not a cure for depression. There is no cure for depression, but it is for many, many people an effective treatment. What we find is that most people who do well with TMS continue on medicine, but in lower doses and often fewer medicines. So a successful outcome, maybe not the perfect outcome, but a successful outcome would be to continue feeling well on lower doses of fewer medicines. And also keep in mind that about a third of people who have TMS do come back at some point for another round of treatment. One might think, well, so this isn't really going to, I have to keep coming back. But, after you have suffered and struggled as long as our patients have to find something that works for you, when TMS works, you don't mind coming back. This has been our experience. You don't mind coming back in a year or two, or even in 6 months, because it's such a relief to know there's something that really does work for you. So there's a tremendous amount of information on the internet, as one might guess. YouTube has many videos that show how TMS works, what it looks like, and I encourage people to go to those, particularly the NIMH, the National Institute of Mental Health, has several good videos. We have, of course, our own website, concierge-tms.com, and we have a lot of information available to people. And then also the Neurostar website is very packed with information. That's neurostar.com. There are several companies that make TMS systems, and different offices use different systems. We use the Neurostar system. I feel that we give our patients the best chance for success and also the safest experience possible. But it is the first system approved by the FDA, and the system has many built-in features which really provide for the most comfortable experience, but also the most accurate experience, and the one with the least risk of side effects, in my opinion. So the first visit is longer than any of the daily treatments, because we do what we call a mapping on that first visit. So everybody's head is a little different in shape and size, and we need to determine precisely where your prefrontal cortex is. It's an area that the prefrontal cortex is about 2.5 inches in diameter. So it's not like we're looking for a head of a pin, but we do need to identify it, and we also need to determine how much energy we're going to use. So each person's a little different, in the same way that people have different tolerances for the sun or different tolerances for alcohol. In the same way, everybody's chemistry is a little different. So it typically takes about 25 to 35 minutes to determine those two important things, and then we give the person the first treatment. When somebody walks into the room, what it looks like is it's almost like a dentist's office, where there's a very comfortable chair, and behind the chair, that magnetic coil. In a dentist's office, it would be the drills and whatever hanging from this armature, but in our office, it's the magnetic coil that's sort of hanging in the air there a bit. And we get a person comfortable in the chair. We try to explain to them exactly what we're going to be doing, and then we get the job done as quickly as possible. That mapping procedure is painless. It's actually interesting, because each patient actually assists us in determining that in a way that I explain in detail to people when they first come in. I've been a psychiatrist for 40 years. We've been now doing TMS for about 5 years, and I take a lot of pride in the fact that we really do whatever we can to make sure that the experience that works for patients. That everybody who comes to see us has been struggling for a long time. There's nobody who comes to see us who hasn't been struggling for a long time, and we appreciate that people often come to us really desperate for help. And that leads us to, do whatever we can, whether it means, being at the office on a Saturday. In some cases, we've gone to a person's home to pick them up because they didn't have a ride to the office. We call it Concierge TMS because we really try to deliver very personalized service. And I don't think that's always available in TMS offices that are parts of chains or in hospital settings, more institutional settings.